Welcome to the podcast. My name is Dr. Nora Gajraj. Let's talk about dysbiosis, an unseen imbalance across your body's ecosystems. Defining dysbiosis, when the balance is lost. Definition, an alteration in the composition, diversity, and/or function of the microbial community, leading to a detrimental effect on the host. Characteristics, reduced diversity of beneficial microbes, overgrowth of potentially harmful microbes, shift in microbial function, e.g., increased inflammation driving metabolites. Beyond the gut, our body's diverse microbiomes, human microbiome, collection of all microorganisms, bacteria, fungi, viruses living in and on us. Not just the gut, the skin, which provides a protective barrier and immune modulation. Oral, the mouth, involved in digestion, dental health, systemic links. Vaginal, reproductive health, protection from pathogens. Lung, emerging area of research. Respiratory health. Each site has a unique, specialized community. Key functions of a balanced microbiome: eubiosis, defense, protecting against harmful invaders; metabolism, assisting in nutrient processing and energy; immunity, training and modulating the immune system; communication, interacting with host cells and other body systems; barrier function, maintaining the integrity of protective surfaces. Manifestations of dysbiosis, site-specific examples: gut dysbiosis, irritable bowel syndrome, inflammatory bowel disease; metabolic disorders such as obesity, type 2 diabetes; food sensitivities; skin dysbiosis, acne, eczema, psoriasis, increased susceptibility to infections; oral dysbiosis, periodontal disease, cavities, bad breath; systemic inflammation links; manifestations of vaginal dysbiosis, bacterial vaginosis, yeast infections, increased risk of sexually transmitted infections. The interconnectedness, dysbiosis and systemic health. Key concept: local dysbiosis can have far-reaching systemic effects. Examples: the gut-brain axis. The gut dysbiosis has been linked to mood disorders such as anxiety and depression and neurodevelopmental conditions. Gut-skin axis. Gut dysbiosis impacts skin health and inflammation. Oral systemic link. Oral dysbiosis has been linked to cardiovascular disease, diabetes, and adverse pregnancy outcomes. Immune system modulation. Dysbiosis at any site can dysregulate the immune response, contributing to inflammation or autoimmunity. Diagnostic approaches: site-specific and general. Microbiome analysis, DNA sequencing from the stool, saliva, skin, and vaginal swabs. They provide microbial composition. Metabolite profiling, identifying microbial byproducts, e.g., short-chain fatty acids in the gut, specific volatile compounds in the mouth. Inflammatory markers, blood tests, CRP, ESR, for systemic inflammation. Clinical symptom assessment, detailed patient history and symptom correlation. Visual physical examination for skin, oral, and vaginal manifestations. Restoring balance, holistic strategies, general principles, dietary modulation, fiber-rich foods, prebiotics for beneficial gut bacteria, fermented food, probiotic sources, limited processed foods and sugar, targeted probiotics, prebiotics, Strain specific for particular conditions and the sites, e.g. vaginal, oral, gut. Stress management, mind, body practices, meditation, yoga. Adequate sleep supports immune and microbial health. Appropriate hygiene, gentle, microbiome-friendly products, skin, oral, vaginal. Judicious antibiotic use, only when necessary with rebalancing strategies. Key takeaways. Your body is a complex ecosystem of diverse microbiomes. Dysbiosis is an imbalance that can affect multiple body sites. Local dysbiosis can have systemic implications. Lifestyle and informed choices are powerful tools for microbial harmony. Invest in your microbiome for comprehensive well-being. Thank you for listening to this podcast. Please consider buying my new book, 100 Pathways to Longevity, and subscribing to this channel. Thank you again.